Okay, so this is a hypertension medication practice question. So the first question is, which class of antihypertensive medication is contraindicated in pregnancy? So which one do you think should not be given in pregnancy? Is it the ACEs inhibitor, the beta blockers, the calcium channel blockers, the thiazide? I know the answer is written there, but please just try to see if you can remember which one do we give for that you should not give when somebody is pregnant. So another question they can ask is, a patient 23-year-old is sexually active. 23-year-old is sexually active, and they can ask you, which of the following medication can be discontinued, because the reason is that even though it wasn't mentioned that patient is pregnant, but for the fact that patient is sexually active, there's still possibility that this patient can be pregnant. Okay, so the answer is ACs. Okay, and also remember another important thing: calcium channel blocker. Depending on the calcium channel blocker, we have two types or two classifications of calcium channel blocker. We have the dihydropyridine and non-dihydropyridine, and we say that, you know, calcium channel blocker, because it causes fluid retention. Okay, fluid retention can lead to fluid overload, and you know that this pregnant woman already have a lot of fluid. So because of that, it's very important to know that some calcium channel blocker may not be safe in pregnancy, why some can be safe in pregnancy. So if you think about the one that is safe in pregnancy, is usually the nifedipine. Okay, the nifedipines are the ones that is safe in pregnancy, but giving them diethelza, verapamil, those ones are not safe in pregnancy. And these are the things you need to remember, because the calcium channel blocker can be safe, but not all of them. So beta blocker is safe in pregnancy. Thiazide is safe in pregnancy, but remember, thiazide can cause orthostatic hypotension. So the answer is ACs. And when you talk about ACs, we say that the side effect of ACs is angioedema and angioedema and dry cough. So, and also when somebody is in ACs inhibitor, you cannot give it together with apps. So what does that mean? If somebody is taking lisinopril, you cannot combine it together with lecithin. So these are the things you need to know about ACs and apps. So the next question: which antihypertensive medication is most likely to cause a cough? So which of them can cause a cough? Lecithin, lisinopril, hydrochlorothiazide, amlodipine. Which antihypertensive can cause a cough? So that dry cough. So if you choose lisinopril, you are correct. Lisinopril causes a cough. Okay, especially in the first 2 weeks you started patient on lisinopril, it can cause cough. Which medication is a potassium sparing diuretic? So this is another class of hypertensive medication. So they're asking you which of them is potassium sparing. So we have the spironolactone, rotidilidone, hydrochlorothiazide, furosemide. So which one is potassium sparing? So the answer is spironolactone. Spironolactone is potassium sparing. And always remember, they can also ask you other questions about that potassium sparing. So what are other questions they can ask you under potassium sparing? You also need to remember that in potassium sparing, they can also ask you about the side effects. We have two most common side effects, which is the galacturia and gynecomastia. Galacturia and gynecomastia. So another important thing to remember is potassium sparing diuretics that you can we use it in people that have PCOS. If you remember the topic on PCOS, and another important thing is that it can also be used in the PCOS because of those hirsutism, the acne, also to maintain their blood pressure. But we use it in PCOS, and also the potassium sparing diuretics. You need to educate the patient to avoid potassium supplement, and because it is holding back the potassium, is potassium sparing. Because of that, they need to, if they have a kidney failure, they cannot be on this medication. So please, every point that I'm mentioning is very important for the exam, and that is why it's a high yield point. So please take note of all the points I'm mentioning. So, which antihypertensive class is preferred in patients with diabetes and proteinuria? So, which of the classes is preferred for somebody that have hypertensive and that have diabetes and proteinuria? So, is it the calcium channel blocker, the ACC inhibitor, the alpha blocker, the beta blocker? So, which one is safer for people that have diabetes? So, the answer will be the ACEs inhibitors. So that is why if you look at the guideline, as soon as somebody have hypertension and have diabetes, you have to start them on ACEs or ARBs because you want to protect, is kidney protective. So the same thing when the patient starts having that protein in the urine, it can also lead to that sign. So it's very important you start them on ACEs. The next question: which calcium channel blocker is commonly used for hypertension? So, which one is commonly used for hypertension? So, all these points mentioned here, all these options, they are all calcium channel blocker. We have the fidepine, we have the tezam, amlodipine, and verapamil. If you remember what I said, nifedipine and amlodipine is is under a different class with Dalteza and Verapamil. So the one that is dihydropyridines, you will see that is different from non-dihydropyridines. Okay, so the dihydropyridines, these drugs primarily act on the blood vessel, it causing it to relax and expand. So that is why we say that calcium channel blocker is a vasodilator. Is a vasodilator because if they ask you the mechanism of action, it is what? It acts on the blood vessel. When it acts on the blood vessel, it relaxes and expands the blood vessel. So that is why it's a vasodilator. Okay, and the medication that is under the dihydropyridine, which we know as DHP, that is the amlodipine, nifedipine, felodipine, and nimodipine. The most common two there is nifedipine and amlodipine. So they are used in treating hypertension and conditions like coronary spasm. Then we have the other class, which I mentioned, that is the non-dihydropyridine. So how does this non-dihydropyridine work? They work by blocking the calcium channels in both the heart and the blood vessel. So they block the calcium channels in the heart and the blood vessels and reduce the heart rate. So this is why we say that these ones affect the pulse. So they affect the pulse. It's not good in pregnancy. It affects the pulse, reducing the heart rate, it reduces the heart rate, it slows the cardiac conduction, and it decreases contractility. So example of those ones is your verapamil and the diatesa because they work along. They have so the same thing with the diatesam. They affect the heart electrical activity, and also it affects the heart electrical activity and the contractility. So just know that both of them affect the ports. That's just what you need to know there. So the answer is amlodipine. The reason we chose amlodipine over nifedipine is that amlodipine is long acting and well tolerated. It's more commonly used, it's more tolerated, but in pregnancy, please take note. If you have question of a pregnant woman, nifedipine will be better choice. So amlodipine, but both of them are in the same class. Dihydropyridine. Please don't forget this. Dihydropyridine. Which antihypertensive medication can cause ankle edema? Ankle edema. This one is so simple. Ankle edema. So is it hydrochlorothiazide, lisinopril, lecithin, amlodipine? So the answer is of course amlodipine. So at this point, you should be able to know the names or the classifications of these medications. Like hydrochlorothiazide is your thiazide diuretics, lisinopril and lecithin, the ACs and ARBs. Then amlodipine is your calcium channel blocker. So one of the side effects of calcium channel blocker that we mentioned is constipation, constipation and peripheral edema. Please don't forget that because it's a vasodilator. Remember, because it's a vasodilator, you can have those side effects. You can have those side effects. Which medication is a selective beta 1 blocker used in hypertension? So metoprolol is a selectively block beta 1 receptor reducing heart rate. So the answer is metoprolol. Okay. So that is the selective. If you listen to my other videos, you will see where I broke down the same way we broke down calcium channel blocker. We also broke down the um the beta blockers. We broke down the beta blockers because under beta blocker, you can listen to those videos. We have the one that is non-selective beta blocker, and we also have the cardio-selective beta blocker. Okay, so like the non-selective beta blocker, they block, which is a question asking, they block both the beta 1 and beta 2 receptors. So the ones that are non-selective because they block both the 1 and 2. So they don't choose the ones that they block. They block the 1 and the 2 receptors. So those ones that block the 1 and the 2 are the propanolol, the nadolol, and the timolol. But the ones, which is the question, you see, the question that we ask, the ones that block primarily the beta 1 block receptors. So this is not 1 and 2. It just block, and that is why we call it cardioselective. Cardioselective. Okay, they only block the beta 1 receptor that is located in the heart. So that is it. So it's very important. We have other classification, but always remember, like we have other classification of beta blockers classification. But like I said, you can still go back and listen to the video, you know, because sometimes you can have questions on this. You can have questions of this, which is what I said, non-selective beta blockers and cardio-selective beta blockers. And we still have the ones that we call beta blockers with alpha blocking activity. So these ones, they block the beta and they block the alpha, okay, which can dilate the blood vessels. Example of those ones are the cava- cavadolol and lebatalol. So those ones, they block both the beta and the alpha, okay. But for the ones that we commonly know is the non-selective beta blockers and the ones that are cardio-selective. So the non-selective, that is your propanolol. Okay, so we all the things that is mentioned here, they are all beta blockers if you look at the options. But the only difference is that one is non-selective, especially like D, propanolol is a non-selective. Okay, so you also have the ones that is what? Cardio-selective. In the cardio-selective one, we have the metoprolol, atenolol. Okay, then the one that is option A is the beta blockers with alpha blocking activity. So it blocks both the beta and the what? And the alpha. So it's blocking two things. So please don't forget, all these things are things to remember. So that is the classification, but listen again to the videos and know the classification of beta blockers, because you can have questions and things like that. So, which antihypertensive drug is associated with lupus-like syndrome? So, the ones that have a drug-induced lupus. So, the answer is C, hydralazine. Which medication is both alpha? So, this was what I was explaining just right now. Which one is both alpha and the beta, the one that can be used, which medication is both an alpha and beta blocker used in hypertensive emergency? So this is just what I explained now. That is your B, lebathalol. And I explain it again. We have four classification, but I'm not here to talk about all of them. One is non-selective beta blockers. They only block they block both the beta 1 and beta 2 receptor. Then the next one is cardioselective beta blocker. They block only the beta 1 receptor. Then the next one is beta blocker with alpha blocking activity. They block both the beta blockers and the alpha blockers. Then we also have the partial beta agonist. That one is not really commonly used in a primary care. Is blocking both the beta blocking and beta agonist activity. Then the third generation. So these two are not really used in primary care. Which thiazide diuretics is preferred for long-term blood pressure control? So of course the answer is A, because it has a longer half-life and it has a better cardiovascular outcomes. So that is your chlorothalidone. So if you see most patients that are on thiazide diuretics, first of all, spironolactone is not a thiazide diuretics. We say that spironolactone is what? Potassium sparing. Furosemide is not a thiazide diuretic. We said it's a what? Loop diuretic. So that is why in the exam you can easily remove two. So it's remaining two. So the two is thiolidone and the hydrochlorothiazide. So the answer is A. Which antihypertensive medication works by blocking angiotensin 2 receptors? Angiotensin 2 receptors. So the answer is C. We mentioned it the when we talked about the ACs and the ARBs. What does the ARB does? Their mechanism of action. That was what we went through before. It helps to block the angiotensin 2. So you need to know for the exam some of all these mechanism of actions of these hypertensive medications. You need to know it. Which medication is used to treat hypertensive patients with benign prostate hyperplasia? So BPH. I think this is so simple. Which one? And the answer is what? Terazosin. So if you remember, another name for terazosin is Hytrin. So some people use the mnemonic BPH. H for hypertension, H for Hytrin. So that is how they remember it. So BPH. So which one do we use for person that have BPH? and hypertension, the answer is terazosin. Okay. Which antihypertensive medication is most likely to cause hyperkalemia? So, which of these did we say will cause hyperkalemia? Hyperkalemia, the answer is spirolactone. So remember, spirolactone spares potassium, is a potassium sparing. So another one that can cause hyperkalemia is your AC and your APS. Those ones. So remember those ones that can cause um, potassium or that can increase potassium. So what is the education? You need to avoid potassium salt or potassium supplement. Which medication is preferred for initial treatment for hypertension in African America? So, which one is the first line for African America? Okay, outside thiazide, we know that thiazide is the first line, not just the first line. I broke it down. I said thiazide can only reduce it to 0.10. So let's say if a patient have a blood pressure of 190 over 120. The most thiazide can do is to bring it down to 180 over 110. Okay. If a patient have like 190 over 120, so thiazide can only bring it down to 180 over 110, which is still high because we know the guideline according to JNC 8 and according to American Heart Association. So according to JNC 8, if somebody is a healthy elder, they should have like not greater than 150 over 90. Some other people is not greater than 140 over 90. So that is your GNC age. So the answer is B. Thiazide diuretic or calcium channel blocker. Calcium channel blocker is what is mostly used for African America. Which antihypertensive medication is used to treat hypertension and prevent migraine? So, which of them can you use to treat hypertension and prevent migraine? So, the answer is propanolol. Propanolol, which is a beta blocker. So, if you remember our treatment for migraine, under migraine, I gave us two treatments, which is the acute treatment. Like when a person have a migraine, what do we give them? Um, which we call the NSPD, the mnemonic. So whatever you want to use to remember it, which we say that you can give them the NSAID, okay, and you can give them the sa- mm, the let me remember all those medications for. So you can give them the even the emetics. You can give them some triptans, and they can also give them ergot. So that is your acute migraine treatment. So you should remember that. Then, like I said, we use that. They can give them any of those medication, which I call the NSPD. So what is your NSAID, your triptans? They call it somatriptan. So N is your NSAID, S, NS, S is your somatriptan. Then you now have your the ergot. They can also have their acetaminophen, and they can also use what we call like emetics, those medications for that prevent vomiting. Okay, so that is very important. But if somebody have a for prophylaxis, under prophylaxis treatment, we say that for migraine we have the acute treatment. We also have the prophylactic treatment. Prophylactic treatment or maintenance. Maintenance. So under the maintenance one, we use B B C B A C T BACT. So what is B? B is your beta blockers. A is your antidepressant. So your beta blocker like propanolol, okay, propanolol. Then you have A, which is your anti-seizure medications. They can use topremate and divalproate, which is of valproic acid. So they can use topremate and valproic acid. Another one they can use is antidepressant. So one of the antidepressants, they use a tricyclic antidepressant. So remember BACT. BACT is what we use. Your B is your beta blockers. A is your anti-seizure medication, anti-convulsant medication, antidepressants, which is your that T. Remember I said BACT. So you can use a B beta block depending on the mnemonic you want to use. B is beta blocker, A is anti-seizure, C is a calcium channel blocker. Is also used for prophylaxis, migraine prophylaxis, and T is your tricyclic antidepressant. So, and sometimes you can also talk about the supplement we can use in a migraine headache, which is your magnesium, and vitamin B2. Magnesium and riboflavin. Riboflavin is your vitamin B2. So they can be used for migraine treatment. So the answer is A. Which medication is commonly used to treat hypertension in pregnancy? So which one do we use to treat hypertension in pregnancy? That is your methyl dopa. We have explained this again and again. So the answer is methyl dopa. Which antihypertensive class, I like this question, very important, can cause rebound hypertension if abruptly discontinued? So, which of the following hypertensive medication you cannot stop immediately? Because if you stop it immediately, you can cause a rebound. So, it's very important to know those ones, the ones that can cause a rebound and how it works. So, one of the ones that can cause that rebound is what? The answer is your beta blockers. And also, beta blocker, remember that beta blocker, it marks hypoglycemia. So beta blocker marks hypoglycemia. So that is why it's very important that when somebody is diabetic, you have to use it with caution. When somebody is diabetic, you have to use it with caution. Please take note of all the things I'm mentioning. Take note of all the things that I'm mentioning because it's very important. Then the beta blocker also, remember that when it comes to exercise, you know, they have to be cautious when they use it for somebody that is doing exercise. Which antihypertensive medication is associated with a risk of angioedema? The answer is A, lisinopril. And also remember that angioedema is a medical emergency. So anytime you see in the question, they put both angioedema and they put cough, dry cough. Both of them are side effects of ACEs, okay? But it's very, very important to remember that um, angioedema, that swelling of the mucous membrane, it's a medical emergency, please. Which antihypertensive is preferred in patients with renal phenomena? Please, this question is very important. It's really high yield. Renal phenomena. So, do we remember what is renal phenomena? We say that is vasoconstriction. They have those like American flag, which is that white, red, and blue color. Okay, so what you need to do, you educate them to use a hand meeting. You tell them to avoid extreme cold, and please we give them calcium channel blocker. Again, calcium channel blocker, because calcium channel blocker is a vasodilator. Okay, calcium channel blocker. Which medication can cause hyperuricemia and precipitate gout. So which one did we say can cause it? The answer is what? The answer is thiazide diuretics. Thiazide diuretics. And please remember the side effects of thiazide diuretics. Very, very high yield. So remember it. I'm putting it here. It can cause hypokalemia. It can cause hyponatremia. So it can cause hypercalcemia, which is the reason that you can use it for osteoporosis. It can cause hyperuricemia. It can precipitate gout. It can cause hypomagnesemia. It can contribute to arrhythmias and muscle weaknesses. It can also cause hyperglycemia. That is why you have to use it with caution, people that are diabetic. It can cause hyperlipidemia. It increases LDL and triglycerides, and it can also cause erectile dysfunction, but mostly in a higher doses. Then it can also cause sulfur allergy. Very important. That sulfur allergy is very, very important. Which antihypertensive is most likely to cause orthostatic hypotension? If you remember, we have mentioned this. The answer is terazosin, and that is a medication for your BPH. And remember, for BPH, we have two classes of medication for BPH. So please take note. Um, we cannot cover everything in this slide. So, but you should always know the medications and the classification, because for BPH we have the two classification. So one of them is the alpha blockers. The alpha blockers, and you must know the mechanism of action. The alpha blockers is also known as the alpha 1 adrenergic receptor antagonist. So everything I'm saying is in our men's health. Men's health. So under men's health, you must remember these medications because it's very, very high yield. Medications that is used for BPH. What are those medications? First medication is alpha blockers. What are the alpha blockers? They are the alpha 1 adrenergic receptor antagonist. You must know the mechanism of action. What is the mechanism of action? They relax the smooth muscles in the prostate and the bladder neck. So they relax the smooth muscles in the prostate and the bladder neck, improving the urine flow. So this is another question they ask, because they can ask you between the alpha blockers and the 5 alpha reductase inhibitors, which ones is the first line of treatment. The first line of treatment is usually the alpha blockers. Okay, and that is where you have your tamsulosin, those are zocin. So these are the ones we say that they do what? They relaxes. They relaxes the smooth the muscles in the prostate and the bladder neck. So when it relaxes it, it helps the urine to flow. We usually use it for moderate to severe symptoms. Okay. Then the next one is the 5 alpha reductase. So from the word reductase, it is reducing something. So it is reducing the size, it is shrinking the size. Reductase. So this one inhibits the hormone. We call it the DHT hormone, which is the dihydrotestosterone. It inhibits this hormone, the dihydrotestosterone is a prostatic a prostatic growth factor. So it shrink the prostate over the time. So remember, that is the one that we call the prosca, also known as finasteride. So we use this for men with larger prostate, as they take longer to show effect. So people that have a larger prostate, unlike the alpha blockers are people that have small prostate. Okay, so this one will shrink the prostate over time. And another thing, I'm just recapping our men's health because we talked about all this thing in men's health. Another thing we said in men's health is that you need to monitor the PSA level. So greater than 2.5, we take it every 2 years. Greater than less than 2.5, we check it every year. Then greater than 4, we have to do what? We have to refer them. Then greater than 10, there has to be biopsy. Please, is a recap of your men's health for the PSA level. And we also mentioned that if if they are on Prosca and you do the PSA level, what you need to do is to multiply it by 2. So, for example, if their PSA level is 5 or PSA level is 6, you're supposed to refer them, okay? Or let's say, yes, according to the guideline. But what you need to do is to multiply it by 2, which will give you 10 or 12, depending. So the answer will now be biopsy. Okay, so that is why when they are on Prosca, then remember the educations on Prosca. When somebody is on Prosca, the woman should not touch it with a bare hand. Remember those things. She can't touch it with a bare hand. She can have a she can't come in contact with the sperm. Okay, so remember those medications that a pregnant woman should avoid. So very important. Prosca is one of those, and it's very high yield in the exam. We have another class of medication that we use for BPH, and one of the class of medication is the PDE5. I'm recapping your men's health. PDE5. So what are the PDE5? The PDE5 is your phosphodiesterase 5. So this one, they work by relaxing the smooth muscles and they increase blood flow. So that is where you have your Cialis. Okay, remember our Viagra, our Cialis, and we say that we have the Viagra, we have the Cialis. So patients with both erectile dysfunction. So when patients have both erectile dysfunction and BPH, Cialis is the best option. And we say that Cialis has a up to 36 hours. Okay. Then the next medication we use for BPH is the anticholinergics. The anticholinergics, they relax the bladder muscles to reduce the sudden urge to urinate. Please, that is very important for the exam. That is where you have the oxybutynin, okay, and Toradine. So it is usually used like for overreactive bladder, so they can use it. So very important. Know the medication we use for BPH. So what brought us here is the one that can cause hypotension and orthostatic hypotension, and the answer is your terazosin, because we know that terazosin causes this, and that is why we encourage the patient to take it at night. At night. So that can be another question. Educate the patient to take it at night. Which antihypertensive, this question is very, very important, is contraindicated in bilateral renal artery stenosis? Bilateral renal artery stenosis. So which of the medication to avoid when somebody have a renal stenosis? Take note of this question or this particular question. So which of them you should avoid? The answer is ACs and ARBs, please. Very important. This question is very important. This medication should be avoided with extreme caution, please, especially when somebody have a bilateral stenosis in both arteries. Okay, the reason is that this medication can cause a sudden loss of kidney function. They can cause a sudden loss of the kidney function by interfering with the kidney's blood supply. Okay, so here remember the word stenosis, narrowing. Okay, so this medication can cause it. It can cause a sudden loss of kidney function by interfering with the kidney's blood supply, and it's not recommended for patients who have developed a worsening kidney function. Okay, so it's very, very important. So we have more questions on this. I enjoy doing questions, but please, you can go back to the book um, in order to do more questions. So